same as always. We start with a 40-minute presentation, roughly, followed by a Q&A from the audience, and ending with a feedback and discussion section from Carl. And I just see, Carl, you have already started the recording. Thank you very much. So today I am delighted to introduce Marc Broberg. Marc is a physical therapist at Two Trees Physical Therapy in California, so early morning for Marc, where he has been working to help persons with dizziness while developing educational content for physical therapists with interest in this area of practice. Without further ado, I'll pass it on to you, Marc. Thank you very much for joining us today. And it's a pleasure to have you present for us today.
Great. Well, thank you all very much for having me this morning or this afternoon, depending where you are. I'm going to go ahead and share my screen here, if I can do that successfully. And if you could bear with me. And hopefully we get this up and running. Okay, can everybody see the slide okay?
That works perfectly.
Okay, great. Yeah, so again, thanks so much to this group for having me, and Carl Friston in particular, who was really kind enough to respond to my inquiries about the work. There are other people kind of out your way that I very much would like to thank that I've listed here, that have really been kind enough to lend their time and their expertise to try to help me make this transition from understanding things from a clinical standpoint to a more scientific standpoint, and then also seeing how this really comes full circle with some of the frameworks that are influential in my practice as a physical therapist. And lastly here, I have Rebecca Luthwaite at the bottom. I'm not sure if she's able to join us, but she's also an author of optimal motor learning theory, which I think has a lot of interesting and intuitive connections to active inference. And I'd very much like your feedback on how these may be compatible. So I think Christoph already mentioned, I'm a physical therapist here in California. I work with folks with dizziness, probably say best characterized as a functional neurologic disorder, the more we work with it. And I'm trying to develop continuing education content for PTs. And so I find that active inference is very relevant here. So I'm trying to get a better understanding of the vestibular system within an active inference framework. I think the particular appeal is the hierarchical connection. It seems that beliefs, attention, and agency have clinical relevance. And I know that in active inference, much of that is what we would say is subpersonal. But I think these inroads hierarchically are interesting, and ultimately from a cognitive, if not a metacognitive standpoint, these could be interventional targets, but I would very much like your feedback. As I go, I have a lot of questions along the way, and I hope that you feel easy to ask me questions. I think that I'm happy to try to clarify what I think I know, and maybe what I don't along the way. And I would just, very much like to keep this as much of a dialogue as possible as we go here. So just kind of introducing the way I came to understand the vestibular system. We have these inputs that reach the vestibular nuclei, and as a result, we have postural stability, gaze stability, and perceptual stability, importantly. And I think although this is helpful to see which inputs go where, I think what we're missing here is what's offered in active inference, which is just a reciprocal connection to some of these anatomical instantiations here. So we could even add the brain to this formulation and start to think, okay, maybe we're getting holistic and we're recognizing the big picture, and we can see top-down control perhaps. But I still think that what's missing again is the reciprocal connectivity here in this system. So I think that's where active inference can really add to the story. And so just to kind of look at the circuitry here, in what we call vestibular rehab, or trying to help folks with dizziness, what we tend to focus on, and or at least what I learned early on, was the importance of these circuits and these reflexes. And while I would say that they are important, they're only a part of the story here. So you could see, importantly, the rotational VOR, which is when I move my head side to side, the semicircular canals are stimulated, and through a series of reflexive connections, the eyes move opposite of the head. And if we look at the kind of traditional formulations of this, we can see the connection from the vestibular end organs. So just to orient you, we have the semicircular canals in the 3 planes, and we have utricle and saccule, and those are all being stimulated by head movement. And the afferent information is then carried to the vestibular nuclei, to specialized nuclei, the position vestibular pause neurons in particular, and then through the cranial nerve connections, ultimately reach the eye muscles. And so when I move my head, my eyes move in the opposite direction. So you can see kind of what that looks like. If I'm moving my head side to side, my eyes are going to move in the opposite direction. And a couple of things about that is, one, just this formulation of the reflex seems a bit like it's a rubber band or a string. I just move and my eyes sort of move in the opposite direction, and there's this yoking, although there's a delay. The other thing is, if you look at this person, how are they going to cross the street? How are they going to look across the room if the eyes are always moving in the opposite direction? So it doesn't seem to be functional the way it's represented, although we do train it very much this way. If somebody ends up with a vestibular hypofunction, and we'll talk a little bit about what that is, when they need to undergo therapy, there's a lot of focus on turning the head side to side and keeping their eyes focused on a target. And I would contend that that's not exactly how we tend to use this reflex. So there's already a bit of an issue there. Conventionally, what we've learned through some important work here is that in order to move to make a gaze shift, essentially. So if I need to cross the street and I want to look both ways, I don't want to look in the opposite direction of my head. I want my eyes and head to coordinate in a gaze shift. In order to do that, I need to be able to suppress this reflex. And so how is that done? Well, the existing model is basically, here's a goal, and there is what we call a premotor saccadic drive, or a motor command, which is not entirely consistent with active inference theory. But this inhibitory signal then interrupts the message, or attenuates the signal, I should say, at the level of the position vestibular pause neuron, and thereby attenuating the reflex and allowing for a coordinated head and gaze shift. That's the current formulation as we understand it. I'm going to try to take that and the vestibular-spinal reflex and see if we can apply an active inference framework here. The vestibular-spinal reflex is basically the body's balance response to a perturbation or a head motion. And so if my head detects motion, or encodes motion and sends that on to specialized vestibular only neurons, the skeletal muscle can help counteract that. So it's basically our balance response. Now, the problem with that is, if I want to make a purposeful movement, you could see how that would be akin to sort of driving with the brakes on, so to speak. So this reflex has to be attenuated to allow for purposeful movement as well. And the current explanation for that is a little bit different than that of how the vestibular-ocular reflex is inhibited. And so basically we have this formulation here, the afferent information reaching the specialized vestibular nuclei, and going in 2 important directions. One is the vestibulo-thalamic tract, which is where we gain our self-motion perception. And the other is the vestibular-spinal tract, which is postural stabilization. Now, if I have the goal of moving and I send a motor command, to use the sort of optimal motor control language, there is an inhibitory signal that is also generated to cancel or attenuate both the postural stabilization that's unnecessary for a purposeful movement, and also this notion of self-motion perception, so I can basically attenuate the effects of that circuit. The way this is explained is that if it's a goal-directed movement and it's an intentional movement, then we would have an internal model of that movement, or an expectation. So we would send out a prediction and compare that to the actual feedback that we're receiving as the movement is occurring, or that proprioceptive feedback. And if there's a match, or there is a prediction error of 0, then the reflex is attenuated, and we thereby preserve our perceptual stability, and we're able to sort of overcome unnecessary postural stabilization. So that's the in a nutshell, the current formulation. And I'm happy to take questions along the way, but I'm just going to keep going here. There are limitations of this modeling, and it seems like, it's a little bit inconsistent and quirky to say that, well, there's an inhibitory signal for the VOR that's just this saccadic drive. But for VSR, it happens a bit differently when there's a model match. So if there's a prediction about what the movement is going to be like, as that movement's occurring, there's this ongoing feedback about the movement. And if there's a match, then it must be a movement that I expected, and therefore I don't need to attenuate. There's a few problems with that, and one of which is it doesn't seem to account for fine tuning. So you could say that really, quite literally, this model, although it's given some pretty important insight, it lacks precision and precision weighting. And we'll talk about how maybe an active inference model can add to the story. There seems to be a bit of computational complexity, and one thing I can't resolve in this is, does the movement need to start to be generated in order for there to be proprioceptive feedback to compare to that model? And so how does the movement get initiated to begin with if there's a reflex inhibiting it? And at what point is that comparison done, or is it done a priori, and what does that look like? And I think importantly, there's no obvious connection to our other systems. Visual system, I don't see how this current model, it doesn't seem to be consistent with my understanding, which is limited, of how other sensory phenomena are attenuated within the body. Moreover, and I think importantly, clinically, there's no obvious connections to other conditions, and we'll talk a little bit about that. So active inference framework is something that I've kind of just delved into, looking at all of this information and how this might work. And so an active inference framework casts the vestibular system in its role of active sense making within a hierarchical model. So what is sense making? It's resolving uncertainty and the maximization of model evidence or beliefs about the world within and the world without, right? So in trying to make sense of everything in a very active manner, and that is done importantly and quite distinctly from our previous model of the minimization of prediction error. I think our previous model shows that it is responding, the system is responding to the absence of a prediction error, whereas here there is an active role of basically trying to attenuate or minimize the prediction error, which is simply the predictions that come from that generative model about the world minus the sensory info, and in that comparison there. So how is prediction error minimized? It's minimized by changing one's perceptions, or you could say updating the model or belief. or it's done by action, which is either a fulfillment of prediction or changing the sensory samples. Importantly, and I think this is where the key distinction is, that these prediction errors are precision weighted rather. And so I think that's where it adds a nice way of, I think, calibrating the response of the circuitry. And I'll try to show what might be an active inference model that I haven't seen in the literature, but what might be an active inference model of this reflex attenuation. And this is where I would really like your feedback here. The nice thing again about active inference is that it does offer a hierarchical representation of an agency, to use something from Dr. Friston's work, from synapses to sentience and back. And this is really important as a therapist, because maybe it can reveal conscious targets for intervention, sort of these metacognitive beliefs and attention and agency. It's not always presented as that. I think that I would like to know where and if this distinction line lies for, and is it fair to address these types of targets here? And so we'll talk about that as we go on here. And again, there's a unifying framework as this is, based on the theory of everything. So this is just, I want to kind of quickly go through how my favorite way of trying to explain active inference to those that I encounter that haven't seen it, is basically we have this, even though we have a low precision here, we recognize that these are faces, and they're similar and they're friendly and attractive, yet when we increase our precision, we become very aware that there's something wrong there. So we have a generative model or beliefs about faces, and we have a lot of priors, I should say, about an exposure to what that looks like. We've collected a lot of data over the years of what faces look like. So we have pretty robust or strong predictions. And when we sample the subject and make a comparison of our predictions versus what's arriving at the sensorium, the leftover residual, the difference between what we're expecting and what we're actually perceiving, is that prediction error, which then could update our beliefs about that, update our perception. However, given this situation, we have a pretty strong generative model, and what we feel very confident in, and we have a bit lower precision than we're used to looking at. We don't really do much of an update there. And so that would be probably an example of perceptual inference. Active inference so this is the key difference with this precision weighting, is now we have higher precision. And so we are a bit more influenced by this prediction error. And we, importantly, and this is where I would like the feedback, is this must be an iterative process. So we sample. So just to back up, we recognize there's something not right there. We begin to sample the environment, during which time we sort of suspend perhaps our belief updating, and then we arrive at a new sort of set of beliefs about that particular object or person that we're observing. And this is just I think the most simple way I can try to relate all of these variables without involving, multiple issues with vision, vestibular inputs, and proprioception. So I just try to use that simple model of making sense of sense making, if you will. So maybe either now or at the end, we can talk about if that's an accurate enough representation of active inference. I'm going to move on to trying to apply that framework to the vestibular-ocular reflex. So I've put here the inputs, the vestibular afferents. And again, the problem with this is the vestibular system is basically going to receive these afferents, and they are not attenuated in any way until they get to the level of the vestibular nuclei. So this is where the attenuation would have to happen. So given the active inference framework, I have a question, and I don't know, I haven't seen this, but it kind of makes sense, and I would love your feedback. So if these specialized neurons, the position vestibular pause neurons, if they encode eye position, which is what they're said to do in the literature, then they must have a generative model of it, of eye position. And so they must be sending predictions. And I would assume they're sending those predictions to the ocular motor nucleus. Here's the thing that I don't know, is proprioception, is it being transmitted in a sensory manner to through the ocular motor nerve, right? And so do we need to rename that nerve? And is there a comparison being made whereby I have a very highly tuned or highly precise generative model of eye position, and when I move my head, if I recognize, and I'm saying this as if it's conscious, but if the circuit recognizes in a sense that there is a position error or prediction error about eye position, does it take the action to correct that? And is that how the vestibular ocular reflex works? Let's move on to attenuation. So let's just assume, right or wrong, we still have to attenuate that reflex. And so I'm going to draw a distinction line here between and this is going to get a little busy here. We've got the vestibular-ocular reflex pathway, and then we've got the saccadic pathway. And I tried to be as accurate in its instantiation, but I don't know entirely. But I think the key players here are the burst neurons in the reticular formation of the pons, and they're generating saccades. And in order to generate the saccade, we need to attenuate the precision at the level of this of the vestibular nuclei, thereby canceling or attenuating the VOR and allowing for an active saccade that coordinates with the head rotation. Now it's interesting, and this is what Carl, you pointed out to me in my email, is that this is not unlike, if I understood it correctly, visual suppression during a saccade, right? So there's something about the saccade that's being made that basically tunes down the gain or the precision or the attention to the VOR. Now, I also wonder, is this because I increased the precision or attention to the saccade? Is that the same thing? Is there a distinction there? So in other words, is it more so that I've increased precision elsewhere, or that I've decreased precision at this level of the vestibular nuclei, or is it both, and to what extent? That I don't know. So if we look at gaze shifts, which is what we're talking about here, we can see that I tried to superimpose a couple different studies here, but we have this VOR activity in the gray here, and you can see right about when the saccade is generated is right where we have that pause or the full attenuation. And then as the eyes reach the target and the head is still moving, there needs to be a coordinated effort, which is where the VOR really kicks in. And you can see that there's a grading here. So we have a baseline activity, we have a pause, and then we have this ramp up that basically follows the trajectory of the eye moving within the head and stabilizing there. And so I think that's where, I don't think this could be very readily explained by a model match unless you're kind of coming at it from the point of, to the extent there's a model match, we have attenuation. I think the precision tuning offers a much nicer formulation of this. And so we can kind of think of this as a volume dial here, some adjustments and fine tuning as we're moving. I find it interesting that, before the gaze shift, there has to be an attentional shift. And is that the mechanism? And how would we measure that? And maybe we can talk about that in a bit. Vestibular-spinal reflex, this again is a little messy, but we have a similar process here. And I'd say probably the cerebellum is where this is happening. This specialized neuron in the nucleus, the vestibular-only neuron, is supposedly encoding vestibular coordinates. So I don't know how, I can't work out the computation or formulate it like I did with the VOR. And, I could have been entirely wrong about that anyway, but this is a little less clear as far as what's being compared and is this where the connection is being made. But if we basically put a dividing line, which probably isn't fair, but if we look at the difference between a movement, prime movement, if you will, larger movements with stability, we can see that if we can kind of use some precision weighting here, we can tune down the VSR and allow for active movement. And the nice thing here is that we don't want to fully, most likely, just like with the VOR, once the gaze shift has been made, we don't want to fully attenuate the reflex. We want to be able to simply tune it down to allow for stability as we're moving, right? So we're not going to probably shut it all the way off. Crucially here, this is the pathway by which we feel that there is self-motion perception. And I'm sorry, I was a little late on that transition there. But the self-motion perception is attenuated. And I think this is the key when we start to talk about sensory attenuation and that as its own issue relative to dizziness, relative to probably a whole host of clinical conditions. So when the precision is turned down at the level of the vestibular nucleus, we're also able to not only attenuate the unwanted or unnecessary reflex, but to also tune down any excessive self-motion perception in order to not be distracted by that, I suppose. So if we go now to a clinical problem that we see in vestibular rehabilitation, if somebody presents with an acute vestibular neuritis, so there's a disruption to the eighth cranial nerve leading to severe vertigo, imbalance, nausea, and really it's a life-changing event. And so looking at how one recovers from that from an active inference standpoint, I think offers us really something quite incredible here. So looking at this study that was done, I think also at University College London, these are folks with, they're 2 days into their ordeal, so they're still quite sick and dizzy, disoriented, experiencing vertigo, and they are bravely agreeing to be put in the dark and spun around in a chair. And what they're being asked to do in this illustration here and in this paper was to use a tachometer to basically trace what they were experiencing. And that was the measure of their vestibular perception. Now that's its own action and its own task and probably has a bit to do with what we're going to see next. But you can see that quite remarkably, despite there being a significant disruption to the peripheral vestibular system, self-motion perception was preserved. And interestingly, you can see that what happened here is with the measures of the VOR, which isn't a measure of perception, but it's probably the one way we can actually measure the patency of the peripheral vestibular system. There was an attenuation of the intact sides. You can see here the three lines. The top line is the control participants without dizziness, without any vestibular dysfunction. You can see the affected side is about 50%, functioning at about 50%. And remarkably, the spared side or the intact side was actually attenuated during this process. And so it seems like precision tuning or sensory attenuation is really a key mechanism in recovery. And it's also probably a key mechanism in the other direction for persistence. So you can see that, the good news is that most people do recover within 3 months from vestibular neuritis. But those that don't have a rough go of it. And it's about 25% that go on to persistent state. And once they're in that state, it becomes very challenging. And these numbers look about the same for pain as well, which is another interesting phenomenon. So just to quickly kind of characterize what, the nosology of persistent dizziness is, there's this persistent postural perceptual dizziness as its own phenomenon. And I don't want to spend too much time on this because we have a bit to go and I've already been going a while, but basically there's, it could be triggered by anything, any event, and not necessarily vestibular neuritis, but there's an ongoing state of dizziness that's characterized as you can see in this little wheel here. Looking at people with persistent dizziness, first of all, let's look at the recovery data. So this is a bit of the same paper, same group, but what they're looking at is basically the sensitivity to motion. So being able to the threshold or the amount of time it takes to detect motion in a similar paradigm. And you can see that it recovers nicely at about the 10-week mark. But if we look at another study of people with persistent dizziness, they actually had an increased perceptual sensitivity. So again, overly precise with their self-motion detections. So they have a lower threshold relative to those who are not dizzy. So this leads to a lot of interesting ideas within vestibular rehabilitation, because a lot of times ongoing dizziness is treated like an ongoing hypofunction of the system. And I would say that it really seems to be almost a hyperfunctioning or an inability to suppress or attenuate the precision of the circuitry. So as we move forward here, kind of getting an idea of what are the risk factors or predictors of persistent dizziness. They're not structural. So in other words, it's not the canal or circuit dysfunction per se. It really seems to be these what are called the psychophysical factors. And you can see all of these are probably visual dependence, autonomic arousal, increased body vigilance is probably a proxy for excessive precision or attention. And the interesting thing is, at what point does this reach a conscious cognitive level? So in other words, I'm attending now to my body, I'm attending to my symptoms. Whereas, lower down in the circuitry, we're talking about attention in a very subpersonal way. So it is interesting that that it seems that at some point we reach this level of conscious and affective processing. And Speaking of which, and this is from the paper I wish I would have read much sooner, but the Edwards paper that you had sent me, Carl, was very informative about this, with this being, one's beliefs. And so, again, going back to this hierarchy here, we have these subpersonal beliefs or these generative models, and at some point, we become perhaps consciously complicit in what's happening sort of under the hood, if you will. And I'd love to have a discussion about that. I think clinically, one of the most relevant predictors belief-wise is self-efficacy. So now we're talking about motivated beliefs of recovery. So the expectation I have that I'm going to get better, the expectation I have that I can successfully do what it takes to get better or cope with the situation. We're starting to talk about, again, these metacognitive motivated beliefs. And there's lots of different things we can believe about what's going on with us. And it seems like clinically, self-efficacy is an ideal target if we are targeting beliefs from an intervention standpoint. And so we'll talk a bit more about that moving forward here. But I want to just kind of throw this out there as I hopefully reach a conclusion and have an entree into our discussion. When there is a problem with the vestibular system, and it doesn't necessarily need to be the vestibular system, it could be any event, but let's use this model because it's kind of nice and tidy for our purposes here. And we're trying to make sense of the world with our sensory apparatus. And at the same time, we're predicting and we're receiving ascending unresolved prediction errors that are being compared. We're comparing this in terms of what caused the sensations to what are the likely causes of the sensations, and trying to map that extraceptively, interoceptively, and whatever is unresolved is sort of passed up this hierarchy. And is this maybe a fair assessment that we have this, looking at the message passing between our subpersonal or physiologic beliefs and our cognitive affective or our motivated beliefs? So looking at, again, I know this is a bit of a busy slide, but whatever is sort of unresolved or newsworthy, if you will, or uncertain gets passed up. And I'm also making predictions about what's happening at a subconscious or subpersonal level. And importantly, what we might be able to do is, clinically speaking, work with attention in a conscious way, right? Which I know isn't exactly how we always use it, but can we have an effect there? And so looking at all of this, really as a provider, I think of, okay, well, somebody is going to be, if they are feeling this way, I'm going to have unique access to one's cognitive affective beliefs. And maybe there could be some belief updating that can then lead to sensory attenuation. So in other words, simply giving one the expectation or belief that recovery is possible, giving them the right information. Importantly, giving them success with, and I would say as a physical therapist, with movement and with action to help them perhaps start to recognize that I actually can do something about this. I do have, agency here, and I can use that to sort of resolve some of the uncertainty that may be happening here. Again, this may be, this is obviously overly simplistic, and it may be, that I'm kind of hijacking everything and taking it to a conscious level. But that's, I think, as a physical therapist, that's where I have to reside. And I think I can do things, I can resolve things better, or help someone resolve it better through language, through attention, through beliefs that are at that level, as opposed to trying to think of ways to create these subpersonal kind of reconciliation of what might be happening. I thought I'd just throw this in there, as this sort of like trying to get to the theory of everything, and that one has agency in how they select the information and how they plan and use it. So this could be, I guess, the Markov blanket, if you will. And I don't know if that's a improper characterization, but I thought I would put that out there. And I when I talk to therapists about this, I often talk about this as, permeating the autonomy here, in a sense, or kind of moving into that sacred space of them versus us, and that they are a unique agent. And so I thought I would just put that out there. But just to hopefully start to wrap this up here, what we learn from active inference, or what I've learned, is that there are hopefully these concepts, these themes are unique, robust interventional targets. And I have to say that this is where everything came full circle. My mentor, Rebecca Luthwaite, along with Gabby Wolf, authored this paper, this concept of theory of optimal motor learning. And you can see these very concepts here in the left of autonomy or agency, beliefs or expectancies, and attentional focus. These seem to be, again, these ingredients that have been at play for a while. And I just think that the more I was digging into active inference, the more there seemed to be cohesion between these models, as far as the themes that were emerging. And it could simply just be my bias, but it certainly seems like there's something there. And I think that's where I would like to go with this, is to really get your feedback about any of this, any or all of it, and also maybe chew on this a bit here. I just want to highlight a few things about these motivated beliefs and attention as we put these ingredients together. This goal action coupling is the story, perhaps, of effective connectivity. And I'd like to learn more about that. And I think that if we look here, even though this is formulated for motor learning and performance, you can see a lot of relevance of this focus of attention, focusing on a task goal. And I know that's been in a few of the papers as well, as opposed to self-focus. So we're talking about perhaps that's a way to precision weight or attenuate a lot of the excessive precision or vigilance in an active way. And as the task goal becomes the increased focus, there should be better motor learning and performance. And ultimately, that is going to further enhance one's expectations, and this becomes its own iterative virtuous cycle. So, again, is there something to this? Am I being unfair about personal versus subpersonal beliefs, and how could I better represent this formulation? Is there something that I missed? I'd love to get your feedback, and I thank you for your attention.
Great. Thank you so much, Marc, for this fantastic presentation. A quick unmute from everyone and a round of applause, please. That was very
Thank you very much.
interesting, Marc.
I'm wondering if I could go off screen share so I can see all your faces if you're there.
Yeah, please do.
If you want me to pull up slides, I can do that too. So
yeah, I think in a second it might be useful to pull up slides, but we can maybe go off screen share for a bit, and we can just take some questions or comments or thoughts for now. Feel free to raise your hand or share what's on your mind.
So if just to start, I'll introduce myself to everybody. My name's Ryan. I'm in the DC area. I'm a psychiatrist, and recently found out about this group, and so I really appreciate the chance to be here and listen to these things. It's not something I get to do a lot where I'm at. And so I know I really relate to Marc, what you're talking about today, because we see a lot of similar patients. A lot of patients come into my office and they have these symptoms like dizziness, and they get these huge workups, sometimes $1 million workups, and trying to figure out what's going on with them. So it's a big issue. And to your point, I'm not sure, but you're asking, like, you asked a lot of questions. One of them was, is there like an overly precise sort of detection mechanism going on here? How is it that are we getting false signals, maybe, was one of the questions. Are we getting false signals, or are we failing to attenuate signals that are we usually would, things like that. So I was trying to think of what was the mechanism here. Like, if the mechanism is, I have this overly active vestibular system sending these signals, and I need to attenuate that, or is it that I have a vestibular system sending signals and I don't have a mechanism downstream to subtract that out of the information that the rest of my brain is getting, kind of ignore it in a sense. Mm-hmm. Does that make sense?
It does, and I think you might say based on, I think the Edwards paper of 2012 is talking about, I may already have a highly precise interoceptive system, and it just so happens that I ended up with a vestibular insult, or I had a some kind of stressful event, I had or to talk about pain, I just happened to twist my ankle. Maybe that's what's going on, and there's been some work, and I have other slides too, to try to look at sort of these characteristics of I guess we could say I can't quite think of the term introverted, so I'm there are the idea of, like, are there traits that contribute, are there predisposing factors of that already existed of highly precise or high precision from an interoceptive standpoint, and then we had a triggering event. I think the problem with that is in the clinic, it kind of runs the risk of it's a personality thing, and I think that's where I tried to highlight self-efficacy as sort of the way forward, because that's something that's malleable. That's something that where we can intervene, and maybe if someone arrives at the backstory of how I am may have had a contributing factor, that if that's helpful for them, then great. If not, and if it's insulting, then I think we need to be careful there, if that makes sense.
Yeah, it does. It sounds like they may have this predisposition, and then there's the event, and then they have some sort of hypervigilance after that, where they're just really focusing on this information coming in and can't tune it out anymore, maybe like they did before, because it's associated with some other, like, recent thing that seemed important for their brain to focus on and to continue to, like, try to prevent or something like that. there's this thing called benign positional paroxysmal vertigo. You probably have dealt with.
Right.
And these little otoliths, they call them, get in your vestibular system, start to stimulate it and sending false signals, and people start to get super dizzy, and it's super scary. And then there's this maneuver called the Epley maneuver that we do. And it's very ritualistic kind of maneuver. Someone has to put themselves into, it's almost like a trust, those trust things they do at conferences or whatever, when you were younger. And you go through this ritual with them, and it's supposed to move the head and body in a way that allows that otolith to go through the canal into a less bothersome area. And but we can't look inside their head and see that otolith moved, right? We don't know that.
Right.
We assume that if the treatment worked, that was the mechanism by which it worked. But part of me thinks that at least for some subset of people, what worked was the ritual itself, and this sort of like their ability now to suppress what before was a extraordinarily bothersome signal coming into their brain, something like that.
Yeah, I agree. I think it's a black box, right? Although, you know, there's pretty good modeling of the canals and of the otoconia and how to sort of return them to the utricle. And I feel like there are instances where, you know, it is perhaps very mechanical, to be fair, but I agree that there's very much a ritual involved, and there are folks who really just insist, I need that Epley. You know, there's something about that Epley, and I try to be forthright that, well, it could be doing something. I think the last thing we need is another diagnosis. You know, if there's no evidence of BPPV, but there's evidence that the procedure is working, you know, so in other words, you can put somebody in these positions and they can be quite dizzy. It's a dizziness provoking, you know, the Epley positions are, you know, dizziness inducing. And so you could put them in there, and then there could be something that is being resolved as they gain confidence, perhaps, that, okay, I can tolerate this movement. You know, so I'll say something to the effect of, well, perhaps this is recalibrating your system, but I don't see, you know, mechanistic evidence that you have BPPV at this point. But there, it's very, it is very interesting, and there is something very procedural about that that process in terms of addressing beliefs.
Thank you, Mark. I really am enjoying this.
Yeah, thanks, Brian, for your input.
Do we have any more questions? Otherwise, I think also, Mark, you mentioned a couple of specific ones during your presentation. I'm sure Carl will also touch on these, but maybe just sort of three I noted down. One was about the vestibular-ocular reflex being a generative model. Yeah, sort of on that topic. Another one was about the iterative process, which was further in the beginning.
Oh, right.
Yeah. And
how about I pull those slides up?
I think so, just that we have it in front of us again, maybe if anyone has thoughts on these. And then also the saccades precision and attention, the increase and the decrease. Yeah, maybe if you just pull up these slides again, or other specific points where you had questions, just so we have that in front of our eyes again, if anyone has thoughts on this. Otherwise, do feel free to share thoughts or other questions.
Let me return to that particular slide. So we can start with, well, which would you like to start with, the VOR or the iterative process? I think had to do with sampling the environment, right? What, you want to go there? Is this showing up?
Yeah, it is.
Okay, great. Yeah, so that was my question was, you know, we can resolve this prediction error by updating our our predictions, right? A belief update so that our model is more accurate in the future. And, or I'm not sure, we can act, we can resample the data, if you will. So that's where, you know, I've read and I've reread the important paper on action. I think Brown is the first author, and I still am wrestling with that, but I feel like every time I read it and try to explain it, I get a little closer. So I would love to get some reconciliation here of what I might be missing.
Does anyone have thoughts on this? Otherwise, I'm sure we'll make a note for later for Carl to return to this. But do feel free if you have thoughts or further questions on this.
So that was the iterative process between belief updating and action.
Otherwise, I think we've made a note of that for later.
Okay.
Otherwise, yeah, maybe we can. Yeah.
Go to this one. Yeah. So this is, I don't know if this is a wild idea, but I'm thinking, you know, if it's encoding, if these specialized neurons encode eye position, then are they sending out predictions? I mean, I guess in a way this is a model, right? It's a sense making of, you know, trying to apply active inference. So in a sense, are there proprioceptive cues being sent? You know, if it's not through here, through this particular nerve, you know, this particular circuit, then I think it would be quite slow if it had to go elsewhere. You know, that's just my hunch. And so, in a sense, here is if there's is a reflex in general, I guess you could say, simply a very precise circuit that quite quickly suppresses prediction errors because the model is so precise. Because the way I learned this is sort of like, it's almost like a rubber band, you know, it's like you move and it just moves, the eyes move the other way.
Does anyone have thoughts?
Is this what you were talking about here? Is this what you were? Yeah.
Yeah.
So do reflexes have, you know, some personal beliefs?
Does anyone have thoughts or further questions on this for now? Otherwise, also we'll bookmark this for later. But do feel free if you have any thoughts or questions about this.
You asked, do they have personal beliefs?
I don't. Personal. Sorry.
I know. But it's something analogous to that. So do they respond to some sort of preset expectation? Right. About, you know, how you need to interact with the world, and something like this is kind of very deeply encoded into in evolutionary time into anything that has like eyes that are moving together, you know, not like on the side of their head where they move independently, but like pointing forward, you know. So I think that they could have beliefs in that respect, in that like if a head is moving and my attention is supposed to be here, it has ways already, deep time beliefs, you might call them, deep time expectations encoded in to allow it to do that. Or it just has the ability to do that when you're born, and then you slowly refine that so that you can keep it there. Like the system is there. It's maybe not necessarily preset all the settings, but as you grow up, as you're, you know, a kid looking around the world, at some point, you know, you become able to, you set the actual precise settings and beliefs and expectations for your own body, and then as far as like, if I move my head this way while I need to keep my attention over here, this is how I need to hold my eyes. These are the things that work for me. So you don't necessarily have to do them spontaneously every time. There's sort of a preset, this works most of the time for me. And then there's something else, maybe like your cerebellum, that's like, okay, let's update that a little bit in real time. Does that make sense?
It does.
We are talking about the selection before the action and updating beliefs, right? That's the question? The preference between these two choices?
Oh, as far as the previous, the attempt to explain the saccade, right? The action and the belief updating, is that?
Right. No,
right.
I'm a little bit confusing. Is this slice, the question on this slice, the same as your question from the last slice?
Oh,
like,
not quite. I think the question on this slide is this, is there something to this? I've never seen a reflex sort of explained this way, but as I was going through this, it started to make sense that maybe, there's the nuclei have this generative model that's very precise about where the eye should be relative to the head, and so anytime there's a prediction error, it's quickly attenuated. I think that the and maybe that is similar to, I think it is similar to the previous slide, but it seems a bit more that there's not really any belief updating in this, like there is in the active inference slide, where okay, something is detectably wrong, and so with the face, there's a distortion there, and I need to probe that, need to palpate that with saccades, and then update my beliefs. And so I was just kind of wondering, is that an iterative process? I mean, I suppose it is. I mean, so maybe I'm answering my own question, but it just seems like my understanding and my explanation of it is a bit clumsy, and I'd like to sort of have maybe a deeper understanding of that process, of this exchange, if you will, or this iteration between palpating and updating, observing and adjusting.
Right, and it actually, when I read the book, I also have a lot of questions on this point, I think.
Mm-hmm.
But we will wait for Carl to comment on this, of course. But I just share some of my experience. So one thing that helps me, actually, I talked to ChatGPT about this, so I should provide credit to it. It gave me a story that I think actually give me some hint. So what it says is if you imagine we in like the Stone Age, and we hear some sound in the woods, and then that's a prior. It can mean just there's some wind, or it can mean there's a tiger, I'm in danger. But then at that point, you have two selections, right? It's what's your action, or do you want to go seek out more information to confirm your belief, or do you want to just hide or flee? And at that point, that's actually a personal preference. And through evolution, the brave people who go out to seek for the truth, they may die and because the tiger is there, or they may find out the truth that no, there's no tiger, it's something else. So actually, from hierarchical Markov blanket, you can think that the preference that we select, which way we go, actually is determined by the belief from the upper level of the Markov blanket. And at some point, the upper level is out of our bodies, the evolution system that's selecting among all the agents. So it's So somewhere there's a belief, but it might not be within this agent's blanket. It's from the belief from the upper level of the blanket that dictates what preference you are doing. So coming back down to here, the eye position and the motor action, like which one we take in a particular person versus one patient versus another patient, it might be just hard-coded in their gene, and that's through evolution. And in your previous slides, whether we look at the picture again or whether we update our beliefs, that might be something that's within our own agency. So our consciousness will have the flexibility of determining which action we take. So I'm not sure because I'm still trying to think through this, but the point is some of this preference is what we control from our human self-consciousness, because it's within our Markov blanket. It's some of our higher level controlling the lower level action, and some of them is out of our agency.
I think that's an important point about the agency. So I've presented this sort of arbitrarily as if the precision is presented to us, and
right.
I guess it is when the face is upright, but at the same time, I as an agent can tune the precision. I may be simply uninterested,
right?
Or you know, importantly, I've seen the Thatcher illusion before, so you know, kind of know what this is. So I'm not even probing it. I just kind of, okay, I saw an upside down face, seen this face. So I think that, yeah, that's really gets to an important point there. I think when it's surprising is when there's, you know, sort of the most I guess weight to it, right? And that's when everything probably gets going into action a bit more. But yeah, good point about the agency there.
Great.
Anything else?
And then yeah, sorry. Please do feel free to share any more thoughts. Just, I think you did have one specific question more towards the end. Unless there are any more points on this section. Yeah.
Can I just come in on this one? Hello.
Yes. Hi.
I think one of the interesting things here about these vestibular reflexes, whether it's the VOR or one of the other reflexes, is that these are multi-synaptic reflexes, and therefore there are several different places where drivers and modulation can integrate and readjust the whole system. And it's interesting kind of that Marc distinguishes between the learning and the action, because it seems to me that if you've got branching neurons, I think the whole thing about Bayesian learning would be that you would have the reflex, but you will also update and signal up the chain, your recognition that the action shouldn't be required next time, and you're going to have to update your system so that you won't have the same need to do some action next time. So learning is contemporaneous with the action.
Right. So maybe I'm sort of getting into this false dichotomy here that this is a discrete process of either, whereas I think you might be saying that it's more unified. Is that right? Simultaneous.
I don't know, but all I'm suggesting is that in terms of cerebellar learning or whatever learning as a result of error being detected, you're going to have some kind of updating of the initial model, but you're also going to have some action that's going to take place to kind of negate that error.
Right. Yeah. And then, and you know, to contradict myself further, there is something that I'm recalling about an iterative process of the, 250 milliseconds seems to be popping into my head about this sampling rate, in a sense, of saccades and so forth. And it's sort of the natural pulse at which we palpate the environment. I could be wrong about that.
Great. Then I think there was further towards the back in your presentation. You had a question on saccades, the precision, or the balance between precision and attention, and the increase versus decrease. I didn't fully catch the question. I'm not sure whether you know what I'm referring to.
Let's see. Was it, you said it was towards the back here?
Yeah, towards the back. Oh yeah, I think it was, if you go back, I think it was around from the previous slide.
This one?
I think it was here that you raised the point about, but I'm not entirely sure about the balance between. Sorry, maybe it was somewhere else. Do you remember where the question you had about the balance between precision and attention, and the so the dynamic between increase and decrease? Or might have.
Oh, right. Yes, I do recall.
Yeah.
Thank you. Yes.
Yeah.
Yes.
Yeah, it was earlier. Sorry.
No, that's fine. So
yeah,
it could be here, or could be here. So my question was, is this, we often think about suppression of a circuit. So we think about, turning down the gain or decreasing the precision or de-attending, if that's a word. I'm wondering if, when we think about the saccade, I would think that we're increasing the precision of that particular circuit. And so is this a relative decrease? I mean, I guess if there is an inhibitory signal, if that's measurable, then you would say that, yes, there is simply an attenuation of one, being the VOR, sort of the lower circuit, as opposed to just, I'm thinking about this probably in terms of the spotlight of attention. I've shifted the spotlight because I am expecting a new set of data as I shift my attention, and therefore the saccade sort of follows that gradient, if you will. So I was just kind of wondering, is there an increase of the saccadic circuit, and it's a relative decrease in the precision of the VOR circuit, or is it simply a decrease in the VOR circuit and the saccadic circuit follows that gradient, or is it a bit of both, or a lot of both? If that makes sense.
Are there any
I guess,
thoughts?
is it a relative decrease or an absolute decrease, or an increase of one and a decrease of the other?
Are there any thoughts or additional questions on this for now. Otherwise, sure Carl will return to this as well. And I think, and just one thing that came to my mind as well, just as a small side note, what I find interesting about reflexes, never really thought about reflexes before, that it feels almost as though, well, like if the system is updating, it's essentially learning, and it feels as though reflexes are not intended to be updated upon. Right, it feels as though almost they're hardwired not to be updated. So the only thing that's left is the action. Although I think there is some nuance to this. I do think that in reflexes there is an updating in the gain of the action. I just thought that just came to my mind. I'm not sure what the relevance is, but I just thought that's very interesting also in the model of active inference. When maybe sort of there is a certain wiring as not to make a complete updating possible. Yeah, any more thoughts or questions for now? Otherwise, I do think it is your turn now, Carl.
Good. Is it my turn now?
I believe so.
Right. I'm glad you didn't solicit any more questions. I can't even remember the number of questions that have been raised. So my job now is to try and summarize in the next half hour, if you can hang around, but if not, this has been recorded. All the glorious ideas and questions, which I cannot even remember. So, but let me just backtrack for a second. In answer to your question, is this a story worth telling? Absolutely. And I would sort of accept that it is worth telling and ask the next question, how many stories are you going to have to tell? So you could face the challenge of telling a story that would be engaging for people in computational anatomy, neurophysiology, brain imaging, cognitive neuroscience, where you'd actually the mechanistic insights that are brought to the table by applying active inference to this particular system and pathologies of this system now become amenable to modeling, to empirical investigation and the like. So you will be in the weeds in terms of questions that you were posing or addressing just a few moments ago about, is this a relative change in the gain in a hierarchical generative model, or is it sufficient just to modulate the gain of alpha motor neurons in some classical motor reflex or autonomic reflex arc? So these are the kinds of questions that a physiologist and a pharmacologist would be interested in, and a theoretician would be interested in, and possibly even a developmental roboticist would be interested in. There's another kind of story, though, which is probably equally important. It's the kind of story you could share with your patients, a story which makes sense of the way that, as you put it, they make sense of their sensed world, or sense of their sense making, that gives them a framework, much in the spirit of sort of classical CBT, as to why this is happening to them and why this works and why that doesn't work, or why I'm engaging in this kind of therapeutic intervention. And of course, that kind of story is going to have to be much simpler and much more accessible than the one written for Christoph or Andrew. Yeah. So I think there are, if you really want to pursue this, and I would very much encourage you to pursue this, and the pursuer of this, I think, will be in the long term a series of academic papers, but for very different kinds of journals, or very different kinds of audiences, where your more narrative explanation and story inherits from your formal understanding, but does not frighten people with with your detailed microcircuits, or an explanation of the neuroanatomy and physiology of the vestibular-ocular reflex. So much of my feedback is going to be schizophrenic, in the sense that sometimes I'll be addressing some of the issues from the point of view of the computational anatomy of this system and its pathology, that you would write for something like physics of life reviews or structure function brain mapping or something like that, as opposed to something you might write for a much more clinically orientated journal, say so neuropsychoanalysis or something along those lines. There were lots of really quite fundamental issues which were brought up, which I'm tempted to just mention now before I forget them. So the question about the relative gain is a really interesting one, and the answer to the question is both. Because mathematically it is just the relative precision of the higher level priors relative to the lower level, usually called sensory prior precision, that matters. And that ratio, that relative precision, is mathematically expressed in something called the Kalman gain in Bayesian filtering formulations of sense making, and by implication also linear quadratic control in robotics. It's just the relative precisions that matter, and this is made very explicit in technically in terms of things like the hierarchical Gaussian filter. So the question, you know, is it am I changing my sensory precision, or am I changing my prior precision, the precision of beliefs about what I am going to do next, is only interesting when it comes to the physiology and the biophysics of this. You know, is it my gamma motor neurons, or is it some excitability in premotor cortex or the cerebellum that is important? There are ways of addressing that empirically, but functionally and mathematically, it's just the relative precision that matters. Other questions. One interesting one, I think, from Ryan was, you know, is this broken primary afferents that is causing the problem, or is this a failure of the tuning and the gating and the gain control, very much in the spirit of classical gate theory of pain, and now in terms of active inference, the gating or the selection afforded by optimizing your precision, the excitability or the gain of the prediction errors, reporting that sort of primary afferent. I think it's a really interesting question, and I'll pick up I'll just point you to a literature that might hold some answers from an empirical perspective. My intuition and all the empirical evidence I know about suggests it's the latter. It's a failure of the gating, and it's the precision control that is broken in most instances, simply because if you've got a neuritis or you've got a deafferentation, then either the primary sensory prediction errors are either just not there, or they're very noisy and therefore have very low precision, and therefore and even if they're not there by Weber's law, they can be construed as very low precision input. So I think all the pathology that arises, and also the functional adaptation to various forms of deafferentation or dysautonomia, for example, are really about how the brain responds to changes in the precision of its input, not in terms of what that input is predicting. So an imprecise sensation is that which is unpredictable and therefore imprecise and uninformative. And you either realize that or you don't. You can either recognize that or you don't at a very subpersonal level. And if you don't, then that's, I think, where the pathologies or the persistent pathologies start to kick in. But it's a really interesting distinction. So I never heard the neuritis story before. So that is very interesting. And I'll come back to that briefly when I survey papers that might shed some new perspective or light on these issues. In terms of the other sort of three key questions that Christoph was trying to foreground by getting you to go back to the key slides, what I'm going to try and do is implicitly answer them by pretending to give you a little presentation, which is just little snippets of presentations I normally give. And in so doing, you would certainly be very welcome to take the PowerPoint presentations that I use if they help in the way that to help you to tell your story. So now this is not for a publication, but more for a presentation to a group like this who wants to understand the sort of computational anatomy. So simple little things like putting your little black box that had the position of the eye encoded, at the same level as the effector organs and the sensory organs. Just put it upwards, and then it all makes perfect sense that it is now an encoding of a latent state of the world that then inherits and is updated by prediction errors that are fed forward from the vestibular system and prediction errors that are fed forward from the oculomotor, proprioceptive oculomotor system, and they have to be integrated and balanced in the right kind of way to make the right kind of predictions as to what you would actually sense in this instance. Crucially, you can't move your vestibular system, but you can move your eyes. So the reflexes are then engaged by the descending predictions that then perform the enable you to elaborate a sensory prediction error that can then be resolved by reflexes. And another big question that came up before I grab the screen and try and show you what I mean graphically. Oh, I've lost it again. Yes. So two other big things. What are reflexes? Can they be learned? And can they be? And what is the relationship or the separation of temporal scales between inference and learning? Do we sample the world in this saltatory way at a theta rhythm exactly, Marc, as you're saying, every 250 milliseconds, or are we continually sampling the world? So I think there are a number of interesting responses to that. First of all, when one moves to more deeper generative models apt to describe things like you and me, as opposed to viruses or very single-celled organisms, or even sort of very simple insects, then one moves from the kind of generalized homeostasis that is mediated by reflex to an allostasis that entails some degree of longer term planning, either explicit planning or certainly reflexes of a slower kind. And usually what happens is that allostatic aspect that is inherited from just having a deep model, and by deep I simply mean having another hierarchical level. The deeper the model, the deeper the hierarchy. As you get deeper into the hierarchy, the temporal horizon usually increases, so that now you're in a position to suspend your reflexes because you have, on a longer time horizon, rendered them unnecessary reflexive corrections to what's going on. So I find it useful to think about reflexes as being engaged only when there's a failure of allostatic or deeper planning. And that perspective puts a lot of pressure on our ability to suspend reflexes. And of course, that speaks directly to the importance of sensory attenuation and getting that gain control and gating right, and which is exactly the predictions of the gating or the precision that would have to mediate that selection, which would be a necessary property of any creature that had a sufficiently elaborated body and deeply elaborated brain that was able to control and navigate that or use its body to navigate the world. The question about is this a continuous versus discrete sampling? I think, again, it's really interesting. I'm not sure that there's a principled answer to that, but I certainly think all the empirical evidence points to discrete sampling. It is certainly possible that you can, there may be biological instances of thermostats that just continually measure the temperature and then switch on the heater or switch off the heater when things homeostatically get out of range. But when you move to most biotic self-organization, there does seem to be a discrete sample, best captured by exactly as it's saying, some of the rhythmed visual palpation of the world. Every 250 milliseconds, I will attenuate everything such that my predictions are now fulfilled at the level of reflexes, oculomotor reflexes, and I move and I act. And then I stop acting and I switch off or suspend the sensory attenuation, and then I attend. I see what I've sampled. I make sense of that. I simulate that. I do my belief updating, possibly with the separation temporal scales. And when I've made sense of this particular piece of sensory information, I then switch back to moving. So there's this saltatory aspect to the way that we, or discrete way that aspect to the way that we sample the environment, make sense of it, because it takes a finite amount of time to assimilate. Certainly when you're talking about deep generative models with separation and temporal scales and deeper horizons at higher levels, it takes time to actually make sense of the data that this discrete movement has afforded me. And you see that in nearly everywhere you look, whether you're talking about mice whisking, they whisk at 250 milliseconds, whether you're talking about language production and perception, all our phonemes are uttered roughly at the theta frequency. You see it electrophysiologically in terms of gamma theta coupling in rats moving around mazes, for example. So nearly every instance of active inference in reasonably large creatures seems to have this sort of discrete saltatory aspect to it. And I think that I think lends a lot of power to your explanation and analysis that you were showing, the empirical analysis of the fluctuations in attention that remind me of things like the attentional blink, but certainly from the point of view of saccadic suppression, read as sensory attenuation of both the visual and proprioceptive consequences of an eye movement, that it is suppressed for about 50 milliseconds, then you look at what you've sampled for 200 milliseconds and then start again. And that seems to be the story that best explains all the empirical data. And then finally, the question about inference versus learning. In my world, there is a bright line and very different kinds of mechanisms and timescales for inference and learning. In the sense that inference is basically updating your beliefs about time-dependent and context-sensitive states of affairs in the world, whereas learning is a slower process that is about the contingencies as installed in the parameters of your generative model that you're using to do your inference. So both are going on at the same time, sometimes called continual learning. I noticed that Andrew was calling it sort of contemporaneous learning. In machine learning, this would be continual learning, but you're learning to infer. So you're still doing fast theta-based inferences all the time, but you're slowly learning how to do that better and better as you accumulate knowledge, as opposed to making inferences and resolving uncertainty through your belief updating. So you can certainly tell, and possibly you'll have to, an active learning story when it comes to recovery. So when it comes now to thinking about remediation and therapy and interventions, you're basically going to have to induce a situation in which new ways of making sense of my bodily sensations and my exteroception can be learned. And then if you're lucky, then after 10 weeks you will have learned some a more apt model for now what you're having to deal with. But that learning is learning to infer. And the inference is a fast thing that unfolds by definition, millisecond to millisecond, or at least 100 millisecond to 100 millisecond. So I thought that was an interesting distinction. Just technically, active learning has been around for a long time. So the actual when we invented active inference as a sort of umbrella term for this approach to sentient behavior, it was inspired by the notion of active learning, where active learning is learning in a way where you are optimizing your active sampling the data that will optimize the learning. And this is a really important aspect of active inference. It is often ignored when you're just looking at the biophysics and the Bayesian mechanics and belief updating in the moment. But it becomes really important, I think, in terms of recovery, for example, and interventions, because you're normally, I repeat, trying to instantiate a situation that optimizes the opportunity to learn another way of dealing with these previously unlearned sensations. So active learning itself actually dates back to one of the pillars of Bayes optimality, which is the principles of optimum Bayesian experimental design. So how do I design the best experiment, either clinical or preclinically or basic science experiment, that's going to deliver me the data that optimally resolves my uncertainty about my alternate hypothesis versus the null hypothesis. So there's a mathematics of experimental design which applies exactly to eye movements. So eye movements, beyond perception as testing hypotheses, the eye movement is the experiment. And it is the experiment that complies with the principles of optimum Bayesian optimal experimental design, in the sense that it maximizes the information gain or maximizes the resolution of uncertainty. And I mentioned that because in robotics, that is exactly the intrinsic motivation your supervisor is talking about. It's exactly the same thing. It's basically talking about what motivates us to do something beyond just getting fruit juice or money or rewards. It's the information gain. That's the key. That's the key, if you like, motivator. And that takes you, from the point of view of active inference, into the next world, as it were, which is now, what are my goals? Well, my goals are basically to resolve uncertainty about my world at this point in time. So how am I going to do that? Well, I'm going to make a move on the world that maximizes the information I gain pursuant on that move. And that is the move that has the greatest epistemic affordance, or has the greatest intrinsic motivation, or sometimes it's simply intrinsic value, which is just the value of information. So all of these things fit very comfortably with your supervisor's thoughts about where do the goals come from. And once you've got your goal, once you've got the thing that I think I am most likely to do next, you can just generate all the predicted consequences of that move. You ignore any evidence that you haven't actually yet fulfilled or attained those consequences, and let your reflex just do all the heavy lifting in terms of actually moving your body around to make these predictions come true. So I think there's a deep connection between the different levels of analysis that you are referring to throughout the talk, that technically or formally, if like unified, when you generalize active inference to cover active learning as well, and learning to infer in the optimal way, which is that which minimizes your expected surprise or expected prediction error, or your uncertainty, or mathematically maximizes your expected information gain. I think those are the main points. Forgive the stream of consciousness. I'm talking very quick because I know that you've probably all got things to go off and do, and also this is being recorded. But if you'll indulge me, I'll just very quickly do what I promised, which was just take you through the way that I tell a simpler story to people that covers some of your questions. And then very briefly, I just want to go through a handful of papers that I thought, if you haven't already, in fact, you have mentioned a few of them, but for the other members of the audience, Marc, I'll just flash them up so that you can see the titles, and then people are interested can go and read that paper and see whether there's a perspective or an empirical approach to that problem that may be relevant, or at least substantiates the arguments. So I'm going to try and share now, if I can.
Do you mind if I ask a quick question relative to what you just said? Where does reward fit into that? Is information gain the reward if we were to use that term?
Yes. So now you're in the world of sort of usually discrete state space models in active inference, where you're talking about goal setting as basically inferring what is the most likely thing I am going to do next, given I am a free energy minimizing or expected surprise minimizing thing. And that when you write down the maths of that, it transpires that it separates into two bits. One bit is the intrinsic value, which is exactly the intrinsic motivation, this expected information gain. And then the other bit is the extrinsic value, which is the expected utility, where the utility is defined in terms of the probability that I am going to, in the future, experience this kind of outcome. So it's characteristic of me. I'm a warm, loved, rich thing. So I expect to be at the right temperature and loved and financially well off, and I would be surprised otherwise. So the expected reward is the negative of the expected surprise, which is the extrinsic part of the expected free energy. So rewards here are basically cast in terms of effectively a multiple constraint satisfaction problem, where you invert reward and say anything that is not rewarding is surprising, and I now want to minimize my expected surprise. How do I do that? Well, I just rule out into the future, evaluate what I think I would see, what the outcomes I would experience under this policy or this action, and then evaluate the expected surprise under my prior preferences or the things that a priori I think are characteristic of the kind of thing I am, which is, not a loser, to invoke a Trumpism. So a loser would just be somebody who's continually surprised. So that's where the reward parts sits. And that is one aspect of this more generic expected free energy. And the other aspect is the expected information. I can show you briefly how that plays out in a couple of slides. So don't let me forget to do that. What I wanted to do, just by briefly showing you these slides, which I repeat, if you want them, then I can send them to you so you can edit them and repurpose them for or use your graphics to populate these slides. I think that some of the discussion about sort of getting the basics of active inference, do I change my mind to make my predictions more like my sensations, or do I act in order to make my sensations more like the predictions? I think that's level one. And then level two would be, where do the goals come from, which is what we've been talking about in terms of these intrinsic and extrinsic values of certain actions that have implications or consequences. And then after level three of the story would then be, where does precision get into the game? How can I now contextualize this? How can I now choose between perceiving or acting, both of which are going to minimize surprise or prediction error? So, there's no lawful rule which says you should use one or the other or both at the same time or alternately, simply because the only imperative is to minimize surprise and prediction error. So the way that I normally tell this story is to start off with the basic idea that there are two ways of minimizing your surprise or your prediction error or your variational free energy: change your mind or change the data that's being sampled, and then give people an example that if they've had some basic neuroanatomy training, that they will see immediately that sort of highlights the role of reflexes in this as a sort of an add-on to a deep world model or generative model. So the story here is that your retinal inputs, visual inputs, exoreceptive inputs come in. They're in receipt of top-down predictions. They elaborate a prediction error that's sent up to update expectations in the early visual cortex, that then vitiate the prediction error, explain away the prediction error. But of course, these predictions or expectations are themselves hierarchically in receipt of higher order predictions, thereby elaborating higher order prediction errors that themselves they then use to drive and to revise and update your Bayesian expectations or beliefs about the latent causes. So you've got in people's minds now this hierarchical levels of abstraction, where every level is just trying to predict the level below. So you've got now an explanation for your sensorium at multiple levels of abstraction, which is the most plausible in the sense that you minimize surprise or prediction error at every level. And the key thing is that anything that comes from the lower level, so vestibular input or proprioceptive ocular input within the brain, is a prediction error. It's just the newsworthy, the interesting information that you didn't predict that is then used to update your beliefs until the prediction error goes away, at which point you've minimized your surprise or your free energy. But the key point that the slide usually tries to make is, well, let's just look at that for a special kind of input, say proprioceptive input from the oculomotor system. It could come in to, say, the pontine nuclei. It could be in receipt of top-down predictions, and I could elaborate a sensory prediction error of a proprioceptive or interoceptive sort. So this could be a sort of vestibular one, but in this instance, it's going to be proprioceptive because there's another way of minimizing this. I could minimize it by driving using unattenuated ascending prediction errors to update my expectations about where my eye was pointing and what I should subsequently feel in terms of the stretch receptors from my ocular muscles. And I could revise my predictions and then change my mind. Oh, my eye's pointing over there. Or, and this is where the reflex comes in, I can take this prediction error and just send it back. So now we have a descending prediction error that doesn't get into the CNS because it's been attenuated, and therefore it is now going to drive the muscles via neuromuscular junctions that will cause the muscle to find its length such that it now returns the appropriate stretch receptor proprioception. So this is where the reflex arc basically, from the point of view, the story you would tell a neurophysiologist, gets into the game. It is there basically to fulfill the predictions. And once you've got that model in mind, you can then tell a story about corollary discharge, reafference copy, efference copy, and the like. The key part of that story is that, imagine that you've got some goal in mind, some intention, some central pattern generator that then is generating the predictions of what I would sense if the world was evolving according to my autonomous dynamics and beliefs about how I was causing my sensations. And notice that you're creating your own sensorium here, simply because you are actively palpating the world, to use your phraseology. And of course, those predictions can be multiple modalities. It could be in terms of proprioceptive predictions, or they could be in terms of visual predictions. And from this point of view, things like motor commands and corollary discharge are just the same thing. They're just predictions. They just happen to be in different modalities. But then the thing that distinguishes them is that these predictions can be now fulfilled by reflexes. And using this very simple model, you can sort of, you can sort of build, let's not going to do it for me. Never mind. You can build sort of quite simple models of things that look quite biomimetic in the sense you can reproduce smooth movements by, in this instance, this generative model has this abstract state space with an autonomous dynamics encoding these successive point goals. So there's still this saltatory aspect to it. That, from the point of view of the generative model, prescribe a location in extrapersonal space. And the model also thinks that the finger is pulled towards these jumps from different points with an invisible spring, and therefore makes predictions. I should be feeling my finger being drawn here and then being drawn there. And also I should see my finger being drawn here and drawn there. And then the reflexes just automatically fulfill the proprioceptive predictions, and then generate exactly what you thought you were going to predict, you're going to see predictively. This also sort of reinforces this notion that you can get sort of what looks like sort of quite continuous belief updating and action, but under the hood is actually quasi-saltatory. It's actually driven by a series of unstable fixed points in your pattern generator. And the reason I chose this thing is just to I'll just briefly flash this up because you can go back and look at this part of the literature in active inference, where this decomposition of the underlying goal or affordance of any particular action can be written in terms of risk and ambiguity, or in terms of intrinsic and extrinsic value, where, as we were just discussing, this intrinsic value is just the intrinsic motivation, sometimes known as Bayesian surprise, or if you like information theory, it's mutual information, while the extrinsic value is just the expected value or reward, if you like, or negative surprise. And there's some very nice maths about why you can sort of carve up the affordances, the expected free energy, in different ways that you can get into. I think the reason I'm showing this is where the goals come from in active inference. So this is the action that I'm going to choose, and this action will bring about these consequences, and this is what I'm going to use my reflexes to fulfill. And then you can move on to the story of how do I do that? And to do that, I need to close this chap here, and then go to the go back to the beginning with this basic active inference thing that you were showing, in a very similar way, and just ask the question now. Okay, so do I change my prediction, or do I change my sensations? Do I sense make, or do I act? And this is where, if you had to do one or the other in this saltatory way, the precision gets into the game. And the way that I describe that is by using bird song, and just say, look, if I had some, in this instance, a higher vocal center that was basically modeling, for you, this would be sort of the position of the eye, for example. This would be your black box. And this black box says, okay, I'm going to sing a song. And there are going to be consequences. I'm going to feel my muscles move, and I'm going to hear myself singing. And I would therefore have my proprioceptive and exteroceptive and possibly interoceptive predictions all diverging as motor commands in some context and corollary discharge in another. But if I'm listening, I'm going to effectively attenuate the precision of the proprioceptive prediction errors, because I don't want to move. I just want to listen to somebody else singing, for example. But if I now switch in, it's designed to be in. But if I now so I can interpret this as having the ability to elaborate motor commands or corollary discharge, which are just proprioceptive and exteroceptive predictions respectively. But I can now adjudicate, depending upon whether I afford the precision to the sensory or to the proprioceptive, predictions. I can switch on and off the reflexes. So telling you immediately that precision, or the relative precision of certain modalities, usually exteroceptive, relative to other modalities that are equipped with reflexes, and these can be motor reflexes or they can be autonomic reflexes. So we're talking about proprioceptive or interoceptive modalities, means that I can engage action or not. And when I'm not engaging action, I'm basically processing the precise sensory information that has been afforded by making that movement or action with the greatest affordance. So that's how I would normally tell that story, and then you can sort of connect that to classical stories of motor control by just saying, well, this looks like motor commands and looks like corollary discharge, but then make the key point that in order to do this, I also have to have descending predictions of precision, which were the broken blue lines in your graphics, because they actually have to be physically and neuronally emitted and carefully controlled, and there's going to be all sorts of modulatory systems involved in that. But they play, there will be both proprioceptive and exteroceptive predictions of precision that now mediate this sensory attenuation or attentional selection of the appropriate sensory prediction errors. And then you can get into a story about sensory attenuation and sensory attention as being the sort of complement. And then I won't take you through this, but I then demonstrate to the audience. Oh, you've seen this one, good.
I love it.
Yes. Right. Yeah, the rest of the people who are still online will have to go to one of these. And then this, I can't resist to show this one because of your lovely example with the smiling faces that are not smiling when they're inverted. So this is meant to show you how quickly you can readjust your gain or your precision or your excitation, inhibition, balance, or synaptic efficacy of on populations reporting prediction errors just by giving somebody prior precision. So for those people who haven't seen this one, you could have two prior beliefs about this sensory impression, pebble of stones, a collection of stones or a collection of coins. But if I give you a rather precise prior belief that it's actually caused by an artist trying to create a face, then that precision basically completely changes the gestalt and the level of deep explanation you have for the sensory impression that you can't undo. So this is meant to show that within milliseconds, you can change the predictions of precision at different levels in the perceptual hierarchy, thereby changing the relative precision, completely altering your perceptual set and the way that you make sense of things. So that was let me come out of these things now. Finally, I know that your work is really primarily aimed at physical therapies and clinical, but this issue of the vestibular-ocular reflex and how you integrate body and head and eye positions in terms of real navigation is a really practically important issue in machine learning and technology and in robotics. So if you think about drone, certain artifacts that you might, as an engineer, you might want to build, and you want to install active inference as a competence within these, say, autonomous vehicles, you have to integrate all the frame. You have to integrate a common generative model that has the ability to represent things in different frames of inference. So you have to think about the position, where the head is pointing and where the eyes are pointing, to integrate those two things as condition independent factors to actually work out what you would see if my head was looking in this direction, but my eyes were looking in this direction. And furthermore, if something was moving at a particular location. So all these things have to be integrated together within a deep generative model, and this can be done, has been done, So for example, this is a simulation of an agent that can not only look in different directions, but can also move their eyes in different directions. And it's a really complicated game trying to get the right generative model with all the interactions. But what this tells you is it has to be a deep generative model. So it has to have this kind of architecture that integrates by exactly as you were explaining, sort of selecting the right relative precisions for precise information that is updating your beliefs about where my head is and the pose of my head and the pose of my eyes within in an egocentric or a head-centric frame of reference. All of this has to be integrated under one common belief, I am looking over there, or ultimately something over there is causing my visual sensations given the way that I'm currently sampling it. So I just put that up for fun, just to say that, focusing on dizziness and vestibular-ocular reflex in the context of eye movements and visual palpation and visual search is not only a clinically really important thing. It's, when you come to designing autonomous vehicles, for example, it's tremendously important, and not necessarily a solved problem. I'm probably wishing on too much, but let me just complete this because I said I would. For other people on the call, this is the Edwards paper that Marc was referring to, which basically looks at this kind of Bayesian mechanics in the brain from the point of view of functional medical symptoms, and tells a nice story whereby one can remove the stigma of hysteria just by thinking about the biophysics and action on the inside, where action on the inside is now deploying, having the right kinds of predictions of precision, or more simply attending to different levels. So that's that one. So with that, I could. I haven't read this paper, but have you seen this? You have seen this, good.
I have.
Yeah, and hopefully it sort of focuses on precision at some point. I just put this up again, probably if you seem to have read everything, so I'll be surprised if you haven't read this one.
Doesn't mean I understand it.
Right. I put this one up just as an example of storytelling to neurophysiologists and theoretical neurobiologists. So this is how you tell the story in terms of, this doesn't deal with VOR, but it does deal with some related issues, oculomotor control and the like. So telling the story from the point of view of the computation. And then I think your expertise, and where you're going to have to do some hard work, is actually mapping the computational architecture that is prescribed by the cause-effect structure, the structure of the requisite generative model, onto the neuroanatomy and the neurophysiology. And you need expert knowledge. You have that knowledge. I don't. There may be members of the people in the audience that have it, but I don't. You do. It's now your job to make plausible mappings as hypotheses as to how the computational architecture implied by the knowing what the system can do, or more specifically, the kind of sensory content that it can explain in terms of latent causes onto a real neuronal network, given the constraints of neuroanatomy. And that's a really interesting game. It's a bit like solving a jigsaw puzzle. But that's the kind of story that you probably would have to tell, and then you use your ensuing model to generate synthetic data and then use that to match it with empirical data. And that's how you would sort of substantiate or give your mechanistic account of what's going on here a predictive validity, in the sense that it can predict empirical measures of the real brain in terms of the physiology and the underlying anatomy. There's another example of that. Yeah, this is an early example that I did with Ivan, who's a student of Giovanni Pizzullo, doing it for. It was just basically a jigsaw, just looking at all the players in the extended cerebellar system. I'm trying to work out, given I know the functional form of the belief updating under, in this instance, a predictive coding formulation of active inference, how could I map that onto, in a principal way, all the nuclei and the connections, and what emerges from this is, as you might not be surprised, an explanation that rests heavily upon the sort of precision control and gating, but the actual overall architecture, first of all, inherits from just associating as getting the hierarchy right. If you've got the hierarchy right, then you know all the ascending connections or projections must be conveying prediction errors and have certain characteristics in the sense that they drive responses in their targets, whereas all the descending connections mediate predictions that may be predictions of precision and therefore don't have a driving effect, they have a more modulatory effect. So all you need to do is get the hierarchy right, given all the bits of the jigsaw that you know from reading all the neurophysiology and neuroanatomy books. So this is an example. I'm not saying there's any useful insight here, but more an example of storytelling which brings the neuroanatomy and neurophysiology in line with the basic mechanics and the belief updating of this kind of patient or a human subject, for example. What's this one about? Oh, yeah, I'm sure you've read this. I just put this in as a way of both comparing and contrasting the basic active inference reflex, the way that reflexes are used under active inference versus sort of 1980s, 90s motor control theory, which from my perspective is now of historical interest, in the sense that active inference actually goes back to things like the equilibrium point hypothesis of Anatol Feldman, that itself goes right back to ideomotor theory, both of the William James sort and the German versions of it. So active inference is really a resurgence of much more historical ideas that really, I think, transcend what would have been known at the turn of the century in terms of classical motor control and forward inverse models and all that stuff. So, and is much simpler. And this tries to convince people in the 1990s motor control literature about that. I just put this graphic up just to reinforce the importance that there are two kinds of descending predictions: that of content and that of context, where the context is the uncertainty or the precision. And I was impressed by the fact you actually had that explicitly in, Marc, many of your diagrams with these dotted arrows. That's so important. It's really the next step on for grown-ups who know about predictive coding schemes. When they realize it's not just predicting the content, it's the context that really equips these models with context sensitivity and the kind of adaptivity and biomimetic aspects that you need to explain most interesting things. I put this up as an interesting example of how you can actually ask the question empirically. Is it the gain or the precision of sensory prediction errors or higher level prior prediction errors or prediction errors at subsequent or deeper levels of the cortex? You can actually address this empirically. And this was an early example from Rick Adams, who studied schizophrenia, using dynamic causal modeling based upon a precision encoding model of slow pursuit eye movements that are disrupted in schizophrenia. And the way basically he did it was to measure the self-inhibition or excitability of various electromagnetic sources in the brain using electromagnetic non-invasive measures, EEG and MEG, and estimating them on the basis of data and finding, making predictions based upon an active inference model that were then either confirmed or violated in terms of the hierarchical level. Is this the sensory precision or is it the prior precision? In your world, this would be, is this the vestibular precision or is it at some higher level in the frontal eye fields? So that's my favorite example of taking the hypotheses that emerge from an application of active inference to a particular system, and then testing those hypotheses in relation to empirical data by actually measuring the belief updating or the electrophysiological correlates of the belief updating under this hypothetical architecture. I put this up because I was intrigued by your questions about, if I've got a certain kind of neuritis which provides false information of a vestibular sort, how am I going to cope with that? Am I going to recognize it's becoming precise? Am I going to invert the right gain control? Am I going to readjust the balance between my prior and my sensory precision in the right kind of way? Or am I going to attend to it more because, obviously this is quite unpredictable and therefore must be informative. And it's very difficult to know, intuit which way you're going to go. And it struck me exactly the same vexed questions emerge in tinnitus research. And this was nicely summarized by my colleague William Sedley. He's written subsequently with colleagues on this. But I just thought that the literature on tinnitus was not may have given rise to similar sorts of questions that you were posing in relation to vestibular input and the clinical conditions that ensue. So this may or may not be of interest for that. And just a nod to your observations that there are some very particular predictions you'd make when talking about pathology, whether acute or chronic, in terms of a failure of sensory attenuation, or at least to modulate the precision of sensory prediction errors. And you see that time and time again in many different contexts. And I just chose this example. Again, I'm not sure whether I sent you this, but it was a treatment by another colleague, Andrew Owens, of conditions of dysautonomia, where you now have either aberrant gain control or deafferentation of particular interoceptive inputs, leading to things like postural hypertension and the like. And the question that I think this paper was trying to address is, would that render you more sensitive in terms of reporting the information, interoceptive information, or less sensitive? And it's really interesting because when we're talking about attenuating the precision, are we talking about attenuating the precision of the descending prediction errors that drive the reflexes, or the ascending prediction errors that update the beliefs? Because if you attenuate the ones that drive the reflexes, then you will now render yourself more sensitive in terms of reporting what you were otherwise would be ignoring. So if you attenuate the ascending prediction errors that go into the CNS, then you're not going to do any belief updating, but you're not going to notice that your heart rate is changing, or that the vestibular input has changed, simply because reflexively you're cancelling that prediction error, but you'll never know that. So there's this interesting yin-yang between hypersensitivity and reactivity from an autonomic or indeed motor reflex point of view, that inherits from the fact, again, it's the sort of relative precision of your ascending prediction errors or the descending prediction errors that determines an interesting, again, and quite vexed set of questions that arise from this perspective in terms of how do you interpret hypersensitivity to things you can't ignore. And I thought this was just an interesting example that touched on the same themes, but from a completely different sphere, which was dysautonomia. In terms of interoceptive inference, and in fact the second,
just slightly, just to say that in vestibular rehab, there's a lot of stuff about the effects of vestibular suppressants, which take away some of the information coming from the vestibular system after you've had a vestibular problem, which will reduce that sensory input, and people often don't get great rehab as a result.
They don't get good rehab because
they've lost some of the sensory input as a result of medication to stop them being vomiting.
I see. Oh, right. So it's the iatrogenic preclusion of rehab then.
Yeah.
Ah, I didn't know. Fascinating. Right. Okay. Yeah. Well, I mean, yeah, sorry, that's so interesting. I've lost my train of thought. The previous paper, the second author was Mick Allen, and Mick Allen has written this paper. Again, if you haven't read it, I think you'd enjoy reading it, because it's just now a way of telling a story to pure computational science scientists that rests upon exactly the top-down predictions and sensory attenuation when trying to make sense of exteroceptive and interoceptive information. And this particular example uses the somewhat artful, if not, I was going to say fanciful, notion that whenever our heart is pumping blood, then we sort of effectively blanch or decrease the sensitivity of our retina because because there's too much blood rushing around, basically. So you've got this sort of link between the cardiac phase and some very fast, effective sensory attenuation over which you have no neuronal, subpersonal, personal control, and was using that. And if you can learn that this is the case, you can learn that there's a dependency on the precision of your visual input on something that is being on your cardiac phase that can be inferred from your interoceptive input, then you can go quite a long way to explaining sense making right through to why your heart races when you see horrible things like spiders. Indeed, you do. So I like that paper. So just coming back to that, to Andrew's observation and the basic question about how you would use this practically and clinically. I put this paper up just because it reminds me to say that in my experience there are two basic ways that you would do this. Let me just close this and stop sharing. So this is a paper by Patrice Duquette and Vivian Ainley, who has written with some of the good and great around London, with a special focus on this notion of mentalizing interoception. And what I mean by that is, let's stop share that. What I mean by that is one way of using this mechanics therapeutically, which is to say, if this is primarily a failure of sensory attenuation, or it has been perturbed by inappropriate therapy or therapeutic interventions, then is it possible to get some volitional control over the sensory attenuation? And I think, Marc, this is, towards the end of your discussion, this was, is it possible to make what is inherently subpersonal, like saccadic suppression, penetrable through volitional control? So basically that story would be, can you skill people in order to deploy their precision or their attenuation or the selective attention volitionally by getting control over their attention state? And of course, then you get into the story, not of physical interventions, but of mindful interventions and mindfulness and meditation, and just giving people the skill of mindfully controlling their sensory, their prior precision relative to their sensory precision, and you can imagine that. Well, you can tell. You can create a narrative about meditation, basically getting control over the precision of certain usually interoceptive or breathing, like so take breathing as an example. So this is the perfect mental gym to actually suppress all your prior precision and get that sort of sensory precision high, and in the face of all the automatic mechanisms that might actually attenuate it. So that would be one approach, which I think a number of psychotherapists would take. But there's another one which I think you alluded to, which was in this intriguing example, which again I never heard of certain movements to relocate your otoliths, and I thought that was a really interesting discussion about is it useful from the point of view, a diagnostic point of view, even if it's therapeutically effective? And a third perspective on that is you can also use this impenetrable sensory attenuation mechanism to effect by sometimes offloading the volitional control to other sensory attenuation symptoms. So my favorite example is if I got a tummy ache, then I can use the sensory attenuation of all my interoceptive and exoceptive inputs afforded by moving, actively providing stimuli that I am generating. So when I'm rubbing my tummy, I am attenuating all the consequences of that rubbing. I have to, otherwise I wouldn't be able to realize my intentions, because they would be updated by all the evidence I'm not rubbing my tummy. But in so doing, I'm now attenuating all the nociceptive and other, all the afferentation that I would otherwise interpret as, I am in pain. So this is exerting volitional control over sensory attenuation, but not by doing it via the CNS, not by becoming skilled at mental action and meditation and the like, but simply by harnessing what the body does, what I was born with, in order to subvert one sensory attenuation, or use one sensory attenuation in one system to supplant or replace the lost sensory attenuation in another system. So that's, to my mind, quite a simple story that patients could actually get behind, and gives them a rationale. Indeed, Marc, as he was saying, so gives them now a sense of control and an understanding of why they are in control over something which they previously were not in control of, and therefore, I can't remember if it's Andrew or Ryan was saying, but therefore unable to take their attention away from it. So if you can't explain or have any control over a sensation, and you can't attenuate it automatically, then you're going to continue trying to find explanations for this unattenuated ascending prediction error. And of course, as much as you do that, you're going to focus on it. It's going to become more and more central to your life. And of course, you're disempowered because there's no active way of attenuating it. But if you can equip them with an active way of attenuating it, then in principle that should be another avenue. So I just put that there's two kinds of very different mechanisms that you can actually hypothesize this kind of use active inference to suggest plausible remediation or therapeutic interventions that may or may not be learnable. And then we come back to the active learning and creating the right environment and the right experiences and the right prediction errors. So I'm guessing, Andrew, that if you take away the prediction errors, you're not going to learn anything, which is why you're subverting the rehab. Thank you. That was it. That was not half an hour. My apologies.
No, great. Thank you so much. Please, another unmute and round of applause for your presentation, Marc. Thank you so much. Thanks also everyone for joining, and thank you, Carl, for the discussion. That was fantastic. And we look forward to seeing you at the next TMB meeting on Monday, which I believe really will be chairing. Otherwise, have a lovely afternoon and see you very soon.
I want to thank you all.
Oh,
Carl,
sorry.
thank you so much for your generous time and your explanation, and for introducing me to this group. What a valuable experience, and I learned so much. So thank you very much. Very appreciated.
You can go and have your breakfast now. That's good, isn't it? I can go and have my tea.
There you go. Well, thank you very much again. You all take care.
Yes.
Thank you all.
Bye-bye.
Bye. Thank you.